You probably have heard about big data. I mean, it's like artificial intelligence 20 years ago. I mean, at the end of the day, it's just a technology. It's what we do with it. I mean, so the challenge that we have is that first, where do we acquire the data? That could be sensors. You know, if I'm going to find out all your activity during the day, is that really critical to manage your health? It probably is not to the physician. So the key is to say, well, what is the question I'm really asking? And therefore, what's the data that I need to answer the question? Instead of accumulating data and trying to figure out if I can monetize and sell it to somebody. So the challenge of big data is to really go backwards and finding out what am I trying to accomplish. Then if I can figure out what I'm trying to accomplish, let's say, for example, try to find a pre-diabetic patients there, or if I can convince them to lose 7% of their body weight, I can decrease by 50% the chance of conversion to diabetes. If I can do that, that has huge implications. And there's a timing at which I can do that, you know, which is before they become diabetic. So if I can go into a population and I can identify people who clearly are obese, they have the hemoglobin A1C that's elevated, they're clearly not active, and I can somehow reach out to them and give them the tools to change behavior, and I can monitor them effective. Now, suddenly big data has a value, but how do I do that? Well, first I have to capture the data of how active they are, so I need some for the activity level, you know, maybe their weight levels. I have to get some blood data. I have to see maybe some family history issue there, so the EMR and all of that. Well, first I have to make sure the data is right. So you have to make sure the data is clean. The data is going to be coming from multiple sources. As we know, Epic is a big player in medical record, but most of the data is not necessarily in Epic. It could be in different clinics and could be different settings. It could be something we don't record right now, which is your behavior or your lack of healthy behaviors. And so capturing all this data then has to run to an analytics engine. What does it mean? Data for sake of data has no meaning. It's making something actionable that's essential there. So then you have to present it to a dashboard when you have thousands of patients you're following to identify the few that you can move the needle with. And then when you have this actionable data, you have to give you the tool so you can reach out to that patient to basically explain it to them in a way they understand it and get them some incentive and tools to get them to change behavior. And then we all know it takes 12 weeks to change behaviors in our brain. Our brain resists any change of behavior. And so as a result of that, you want biofeedback tools and other mechanisms, which could be peer pressure. So that is what needs to be accomplished.